Hi everyone, thanks for tuning in again, and welcome to Past Physiology review of topic 4 content, all about arthrology, the study of joints. This is what the study guide looks like, so you should have this, and if you don't, go and find it on Brightspace or the portal. And we are going to be using this study guide, breaking down how to use it, how to study with it, and looking at examples of different anatomy, different articulations you'll find in anatomy to exemplify these different types of joints. And we'll try to plug in some different ways to remember these things. Finally, we'll wrap up by talking about some pathologies, which you're probably pretty familiar with already. So I'm going to minimize this study guide over here, and you keep yours in front of you. And we're going to look at some representations of different joint classifications as shown in skeleton premium, made by Visible Body. So before we start talking about these different types of articulations, I do want to mention that there are multiple different ways to classify joints. So you'll see on my table here I have joint class and then some names, but then before that I've got an F or a C or an S. Okay, and they're also, the F's are all white, the C's are yellow, and the S's are blue. Okay, so this is referring to a fibrous type of joint because the joint is made out of fibrous tissue. C refers to cartilaginous because the joint is made out of cartilage. And S refers to synovial because these different types of joints have a synovial sac with synovial fluid acting as a lubricant, okay, within a capsule. So know that, and you're going to have to know which types of joints are fibrous, cartilaginous, or synovial. You're going to need to know which joint classifications are found at what joints, right, in the body. You need to be able to describe the joint, how it moves, how it's shaped, okay? And you also need to know how much movement the joint allows, as in how many axes of rotation are within the joint. And then also, this column right here, if you don't want to worry about it, it won't be on your physiology exam, but you'll want to come back to this for spinal anatomy because these terms are used in spinal anatomy: amphiarthrosis, synarthrosis, diarthrosis, etc. So if you want to just blot out arthrosis, that's fine, but I put it there for you for spinal anatomy for later on. So let's look at these different joint classifications. These are all just different synovial joints, okay? We're going to be coming back to the cartilaginous and fibrous joints. So you're in the blue in the synovial joint classes. And these are not in the same order, but that's fine. I just want to be able to show you these pictures and animations of how these joints work. Okay? So on the study guide, we'll try to keep it in order, I guess. On the study guide, we've got a plane joint first. So if we look at plane joint, this is showing you the facets in your spine. This right here that I'm kind of circling, this is a facet joint. It's the inferior articular facet of the top vertebra and the superior articular facet of the inferior vertebra, but this is a facet joint, also known as a Z joint or a zygapophyseal joint. This is something that you haven't really been exposed to yet in this curriculum, but you will be, and it will be testable, so get familiar with it, that this is a facet joint in your spine, okay? This is your intervertebral disc, okay, but this joint right here, with these two little pokey things, okay, they're not really pokey, they glide and slide within each other. Okay, so this is a plane gliding joint. As this website describes, which is sufficient, it says that plane joints connect the flat articular surfaces of bones. So this is showing you two blocks flat sliding on top of each other. They're non-axial. They have no specific axis of movement. That means they just glide in any which way direction. So gliding and movement occurs when a flat surface glides over another flat surface with no rotation, no change in the angle. So examples would be intercarpal in your wrist, intertarsal in your ankle, and these intervertebral interfacet or facet joints. Okay, so on your study guide, that's what I've got listed. I don't have intertarsal, but you should add that. Okay, your wrist and your ankle essentially are the same thing but with different shapes. So go ahead and add intertarsal if you want. That could be testable. And so if you look at my table, I've got pretty much the same information that we just talked about and that you just saw over here. But, and let's interpret the columns here. The description is flat on flat. Flat, arrow to flat. Flat goes with flat. So that's how I've constructed this table. But notice that I've got some more terms here. You're going to need to know these terms. There are other names for a plane joint. You could also call it an arthrodial joint or a gliding joint. Okay, you could also call it a plane gliding joint or planar joint. This arthrodial one is kind of weird, but you might as well just try to memorize it and get familiar with it because it will come back in spinal anatomy. Okay, so plane, arthrodial, gliding. Hinge joints. Look at
Next, we're looking at the hinge joint, another synovial joint. This functions just like a door hinge, as you can see, moving into flexion and extension. The classic example would be the elbow, made up of the humerus, ulna, and radius. The ulna and radius, remember, are bonded together by two separate ligaments. More proximally, they're bonded together by the annular ligament, which also allows the radius to act as a trochoid joint by itself, rotating in supination and pronation. But since those two bones are stuck together, when they move in flexion and extension on the humerus, they're acting in the elbow joint. They form the elbow joint. The triceps will pull on the ulna with its attachments to create extension, and the biceps, brachialis, and brachioradialis all attach onto the radius and are those prime movers that tug on that radius when they contract and move the elbow through flexion range of motion. So not to be confused with the regular hinge type of joint would be the knee. We'll look at the knee next, and it's very similar, but it's technically a modified hinge joint or compound joint. It's not a classic hinge joint, so don't be confused with that. The better other alternative would be the interphalangeal joint for another hinge joint beyond the elbow.
And then I guess your mandible could be counted as one too. It might get a little more complex in here because technically when you move your mandible, this kind of drops out and slides down. I'm not sure. People classify things differently. So because this app calls it a hinge, that might not be appropriate in other classes. But for sure, focus on your extremities, the knee, okay, the elbow, and your digit joints, okay, your interphalangeal joints. And then this is showing your ankle is one well. I would stay away from that because, don't get that confused with your intertarsals. Okay, so if we go to next on our list is the pivot. The pivot type of joint is also called before I get there, let's go back to the hinge, okay? The hinge joint type of joint is also called a ginglymus. Okay, so these are just synonyms. These mean the same thing. You will see ginglymus on boards. I almost guarantee it. I know I did. If somebody says what type of joint is a ginglymus joint, okay, you're gonna pick a hinge joint. Okay, so the elbow and interphalangeal or the knee. Hinge, ginge. Okay, that's how I remembered it. And that's pretty straightforward. Hinge, ginge, hinge, ginge. So now let's come down to pivot, okay? And we might as well just talk about this other word for it, the trochoid. Think about when you speak the word trochoid, okay? If you look at your mouth, trochoid, you're making an O, right, with your mouth twice when you say the word trochoid. Okay, your mouth just feels like it goes around and around. Trochoid. And that's what the pivot joint does. You pivot like you pivot in basketball. It's a pivot joint is a pin pivoting in a ring. Okay, so let's come down to pivot joints. This is showing the most chiropractically appropriate example, which is going to be the atlas and axis articulation, okay, or the atlantoaxial, the median atlantoaxial joint specifically. okay, and this is the dens, okay, the odontoid process of your C2 vertebra, and this is C1 atlas rotating around that thing, okay. Be sure that you do call this the median atlantoaxial joint, because you do have an articulation with the facets on the outside, okay? So this surface does articulate with C2. That's technically a plane gliding surface out here, but this is what we're talking about, is this dens, the odontoid process, rotating, right? Or technically it's well, they're both rotating, okay? But you've got the atlas sitting on top and rotating around. This is the pin, okay, and this is the ring. There are ligaments in here that you'll learn later, so this is not just wide open. This is technically ligaments, okay, that this pin rotates around. The other example here is going to be the proximal radio-ulnar joint, okay, and feel your forearm, find the head of your radius, and then pronate and supinate your forearm, and you'll feel some rotation in there. You'll feel that bump, okay, moving, okay, and that is the head of your radius, and this is the annular ligament. And if we hide that, we can see the head of your radius here, okay, and it's going to rotate. And this is not animated, and I wish it was, but this is your radius, and it rotates within the annular ligament, okay, which attaches it to your ulna, okay. Proximal radio-ulnar joint is what that is. If we were looking at this joint here, this is the distal, okay, let me get a better view of this here. This is the distal radio-ulnar joint, okay. You got to know proximal and distal, and don't let that trip you up, because the distal radio-ulnar joint is completely different from the proximal. The proximal is where your radius rotates within this ring, within the annular ligament. It's still connecting it to your ulna, but the distal radio-ulnar ligament is just a big fibrous band of tissue, which would fall under the category of a syndesmosis, okay? Syncing two things together, sync. Syndesmosis, it just bonds these two bones together. The distal radio-ulnar ligament is going to be the syndesmosis type. Same thing is going to occur between your tibia and fibula in your leg. Okay, it's the same thing. There are a lot of similarities in the upper and lower extremity, which you're learning. So that's going to, obviously be a very different thing than this trochoid type joint. Okay, so let's go back to more synovial joints. On my study guide, we've got condyloid or ellipsoidal joints next. We're going to be looking at a convex surface articulating with a concave surface. Okay, so if we look at it on this guy over here, let's zoom in on their little animation. Try to get a better view of that. Okay, can you see that? So this is kind of showing a little bit of a domed shape on the bottom, okay, with kind of a cup in here. It's not a ball in a cup, okay, but it's close. Let's see, this app describes it as a convex oval surface fits into the concave oval cup of the other. So it's kind of like a ball and socket, but we're talking about ovals instead of balls. Okay, an egg and an eggshell or something like that. So you're going to allow flexion, extension, and some circular type of movement. So the wrist joint between the radius and the carpals and your knuckles are probably the best example. The metacarpophalangeal joints are going to be your examples. And let's see what we got on the study guide. I've got an extra one for you for chiropractic here. The atlanto-occipital joint. Okay, this app does not show it, but if we jump back to home and we look at some region views and we go to the skull, let's see here. I'm not sure if we'll get a great view of it, but we'll try. So if we're looking at the articulation of your skull and your first cervical vertebra, this is what we're talking about right there. Okay, so these are the atlanto-occipital ligaments, which you can see up here. It's been highlighted, and this is it's going to allow gliding, right? It's going to allow this atlas, I'm going to try to show that better. It's going to allow it to glide kind of like this, okay? And so later you'll be learning like a left atlas listing versus a right atlas listing. You can kind of see, not great because these ligaments kind of hide it, but this atlas will glide up like this to the left, and then this transverse process will be kind of sticking out more prominent up here. It doesn't actually slide left and slide right perfectly. It kind of glides up the surface of the occipital condyle is what you would call this. So this bone, the back of your head, is your occiput. Okay, it's your occipital bone. Okay, your bone is your skull is a bunch of bones fused together, formed by sutures. Okay, sutures, and what forms the sutures are sutural ligaments, which is on the study guide. So that was just a learning opportunity. Skull sutures. Might as well look at that. Those are more fibrous joints. Not much movement should occur there. There will be some movement when you're a baby, but that all fuses and holds pretty tight. There's some limited movement. There's even cranial adjusting that could have some influence on that. But essentially there is technically no remarkable movement. But anyway, this is your occipital bone, part of your skull, and there's a hole here. Notice that. This is the foramen magnum. This is how your brain, right, connects to the spinal cord and descends down your spine, which you can kind of see. That's your trachea. Okay, well, you can kind of see, okay? Your spine's going to be running up, or your spinal cord, right, is going to be running up in the middle of your vertebrae. And the brain stem, so in CNS, we're talking like medulla oblongata mostly, right, running through your foramen magnum and turning into your spinal cord. Okay, and the foramen magnum is in the occipital bone. And then just to the sides of that foramen magnum, you've got these little sticky outy things that are part of your occiput. And these are the occipital condyles, which articulate with the superior facets of atlas. And if we go back and look at atlas, let's see if we can isolate atlas here. Explore the bone. There we go. Here's your atlas. And of course it's not colored like this in real life, but if I can rotate it down a little bit, like that, this is what it looks like from above, okay? And so we talked about those occipital condyles, those sticky outy things in the bottom of the occiput. They're like ovals, okay? And they're rounded ovals. And then you've got little peanut shaped, these are described as peanut shaped. This is not the best view, but if you look in an anatomy textbook, you get go get a bone from the library, I should say. And this is kind of like a peanut-shaped depression or indentation. And so it's sort of like an oval. Okay, it's not a perfect oval, but it's a little peanut-shaped ovalish cup that allows this thing to glide with the sticky outy thing on the occiput. Okay. The occipital condyles. Alright, so I just clicked this skull picture to try to get it around, and there. So those little peanut-shaped cup things, right, are going to be gliding with the occipital condyles. Okay, so those are all examples of condyloid, ellipsoidal joints. It's not a ball in a cup, it's like an egg with a egg-shaped cup, kind of, okay? So look at pictures of these things while you're reviewing, and anytime you can actually visualize it on yourself, of course do that. The most obvious and easy to remember example is going to be your knuckles. Okay, your metacarpophalangeal joints, you can flex and extend those, but you can also wiggle them around in some rotational movements, okay? So let's go to the joints again, and we go back to these condyloid joints, and we go to the MCPs. This is what we're talking about, okay? So there's no movement shown on here, but you can do it on yourself, and you know that you can kind of wiggle your knuckles around in more than just flexion and extension. Okay, if we come down to saddle joints, there's only one saddle joint, and that's going to be your first carpometacarpal. So basically the base of your thumb, it's not the knuckle, it's not the metacarpophalangeal joint of your thumb. It'll go down to where it, articulates with your wrist, basically. And you can really wiggle that thing around in all kinds of directions. So let's go look at your saddle. This is what we're talking about. This is kind of an illustration of, it's like two saddles. Well, I should say, imagine this is a saddle, right? This blue thing, like a saddle on top of a horse. You'd be sitting in it like this. And then it's got this block with a kind of rounded edge, okay, like half of a cylinder. And then here it's showing your actual joint in your body going through those movements. Wiggle your thumb around. So in a saddle joint, the articular surface of one bone is U-shaped, like a saddle, shown in blue, which allows the other bone to fit into it, okay? So this is going to be between the thumb and the trapezium, so you can move it all around, and it's special because it's opposable, and you can do a lot with your thumb. So a way to remember this, if you're struggling with, where to find the saddle joint, is think of like when you hitchhike. Okay, how do you hitchhike? You stick your thumb up in the air, and normally you don't wiggle around, but say you're bored, so you're hitchhiking. You got your thumb in the air, you're wiggling around. Somebody's gonna come pull over to give you a ride, and when they offer you the ride, they say, "Saddle up, partner." Okay, as a figure of speech for like, okay, you can get in and let's go. Saddle up, partner. You were hitchhiking, now you get a ride. Saddle up, partner. Let's go. Okay, that's just a way to remember that maybe it'll stick, and then you won't have to really study it anymore. So the other term for this is seller. Okay, that's just the Latin word for saddle. Okay, you'll learn I don't know if you're getting this in CNS right now, but there's a sella turcica in your skull, which houses your pituitary gland, and it just means Turkish saddle in Latin. Okay, so saddle, seller, same thing. Let's come down to ball and socket, also called a spheroidal type of joint. Spheroid, sphere, you know what a sphere is, okay? It's a ball, so it's just a ball type joint. Spheroidal, ball and socket, same thing. That's pretty easy. The examples of this are going to be the glenohumeral, okay, your shoulder and your hip. The acetabulofemoral is your hip joint. So let's come look at it on here, and you've got a ball in a socket, pretty straightforward. And this is completely freely movable joint that can basically move in any direction, okay? So pretty straightforward. You move your hip around, you move your shoulder around, say ball and socket, and you know that it moves in every direction, so you shouldn't have any trouble with that. All right, so if we come back up here and look at these fibrous type joints, we'll try to find them on this app as well. And the first one is going to be a syndesmosis. We've already talked about that. It's that long band that connects your, basically your arm and your forearm, okay, and your leg, connects the bones together. So the radius and the ulna, distal radio-ulnar joint. And if we go to, let's see here, shoulder, limb over here. Sorry about the delay here, trying to get through. So let's see, for limbs, that's what we're talking about. All right, so that's the distal radio-ulnar ligament. Same thing exists between your tibia and your fibula. You can look that up on your own. Sutures in the skull, we already talked about that. You saw it. It just fuses your skull together. It's really short short fibrous bands, okay? And then the way that she describes the suture is a short fibrous band, but then she calls a gomphosis, which holds your teeth into the alveoli of your mandible and maxilla. She's describing those as very short bands, okay? They're also called periodontal, dental, dentist, periodontal ligaments. So hopefully you don't have to choose between short and very short for a description. You should know periodontal ligament is going to hold the tooth in, okay, the root of the tooth in, or associate the gomphosis with the periodontal ligament. You'll definitely need to know that. A suture and a sutural ligament is too easy for I don't think she'll even ask a question about that. One way to remember a gomphosis, okay, a gomphosis, when you say the word gom, 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 It's kind of like you're chewing gum. Okay, for one thing, gum and gum look alike, and just saying gum-phosis. I just chomp my teeth together. Chomp, chomp, gum, 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 gum. Okay, gum-phosis. Like you're chewing gum with your teeth. It's a tooth joint. Okay, it's the root of the tooth with the alveolus, which is a socket in your jaw. Okay, in your mandible and your maxilla, depending on which side we're talking about. So let's come over here to the vertebral column and pull up a picture of a disc. I can try to zoom in. And the next category, rotate this guy around. Next category is going to be the cartilaginous joints. Okay, there's two types, synchondrosis or symphysis. We're going to jump down and look at the symphysis because it's, maybe it stands out, and it's the chiropractic type of anatomy especially. Okay, so your intervertebral discs between the vertebra of your spine, vertebra, disc. Okay, so that is going to be formed by a fibrocartilage disc, and the same thing is going to happen in your pelvis. And if we come over here and get a view of the pelvis, this guy right here, it's in front. I took a posterior view, but I shouldn't have. This is your pubic symphysis. It is another fibrocartilage disc. Okay, it's pretty similar to an intervertebral disc. Not really. The intervertebral discs are more complicated, but from a superficial view, it looks the same thing. It's a fibrocartilage pad that connects your pubic rami together. Your pubic symphysis is the joint, and the pubic symphysis is a fibrocartilage pad. Symphysis is in the name. If you ever get the question, what type of joint is your pubic symphysis, I sure hope that you pick symphysis joint class because it's in the name. Pubic symphysis is a symphysis joint. But it's so easy, she probably won't ask you that. But she might ask you, what type of joint is an intervertebral disc? But think about it, because an intervertebral disc and a pubic symphysis look so similar and do the same thing. So if you know that a pubic symphysis is a symphysis, you should also know that an intervertebral disc is a symphysis type joint. Okay, they're very similar. So let's come up and look at a synchondrosis. These are going to be things that could be temporary or permanent depending on where in the body they are. A synchondrosis means that cartilage unites bone, and we've already talked in this class about growth plates, okay, in your long bones, where the cartilage divides and expands to create an interstitial growth for length, and then as the cartilage expands, it dies and is filled by calcium. So those growth plates are made out of cartilage. We already talked about this. Made out of hyaline cartilage, which you should know too. And so that is a synchondrosis joint. Syn, syncing things together. Chondro, okay, chondro cartilage. So synced by cartilage. Okay, united in sync, united by cartilage. Okay, growth plate. Perfect example, but it is a temporary type of joint. I've also added metaphysis on here because the metaphysis is going to be surrounding the growth plate, and that is a region of growth. So in a younger patient, that part of the metaphysis will be cartilage still, but the best answer, the most correct answer, right, would be the epiphyseal plate because it's all cartilage. That's where the active cartilage division and growth comes from. Okay. In the younger population. The other example is going to be the only permanent synchondrosis is between the first rib, so it's the first costochondral joint, and that's in your first rib basically. Okay, so that's a permanent as opposed to a temporary growth plate. So that concludes the types of joints. And then next on, we're going to be looking at synovial joint capsule layers and a few pathologies. But before you move on, I think it would be wise to go through whatever anatomy text you use, or just Google up some pictures of these things. Any of these examples that you're not familiar with or that you can't see and feel on your own body, like your elbow is a hinge joint, you can just move your elbow. But if you don't quite remember the facet, review the video, or look up a picture to get that burned into your mind's eye so that you know what a facet looks like, and if you know what it looks like and how it moves, and you know what a plane joint is and how a plane joint moves, then you'll know that a facet joint is a plane type or gliding type joint. Okay, so review this stuff, and I'll see you next time for the other half of topic 4. Thanks for watching.